So when you're preparing the FPU for fat harvesting, first of all, get your Scout nurse to take one brand new FPU out of the box. So the FPU comes sterile already, and make sure you check the expiry date, which is down the bottom. And once you have confirmed that it's within expiry, obviously get your Scout nurse to open up the FPU and drop it into your sterile zone. So simply peel back and drop it in. Thank you. So now you have three components. You have the syringe body, you have the piston that we talked about before, and of course you also have your green cap. Now the first thing to do, grab your piston, and there's a pointy end that goes into the syringe, and just hand push the piston till it sits flush with the syringe top. Now get your hex screwdriver, and in the middle of the piston, you will see a little screw where you put your screwdriver into. Now turn it anti-clockwise, probably 5 or 6 times, and take out the little screw, okay? Leave the screw on the hex screwdriver because you'll need it later on. So simply put the whole thing back down in your sterile zone, and then pick up your Tara lock. So the Tara lock has a little threaded end. That end goes into the piston where you've just unscrewed the little plastic screw. Hand tight only, please don't over tighten it because that will be very difficult for you to remove. Now slowly push the piston down until the locking mechanism is near the flange of the syringe, and make sure they are at 90 degrees with each other, okay? And then push it in, all the way in until the locking mechanism is into the syringe all the way. Then turn it 90 degrees so it locks on to the flanges of the syringe itself. So now it sits flush and it's locked in. So this is now not coming out. So once it's locked in, hold the button down on the Tara lock and push all the way down until it can't go any further. Then take your cannula and screw that on, and make sure you put the cannula on as tight as possible because you don't want any air leaks. Now you will see on the syringe, make sure there is that little black rubber ring, O-ring, because that will seal the cannula. So put that on, make sure it's nice and tight, and now that is ready for the surgeon to start harvesting. So now that you've put together the syringe and ready for fat harvesting, let's talk about what can go wrong if there's no pressure. So as we talked about before, very important to check the O-ring to make sure the cannula is on as tight as possible so that there's no air leaks. That's the first thing that can go wrong. Now sometimes on the locking mechanism here, if it's not pushed in all the way and you try and lock it, it will get stuck on the flange of the syringe. So it might be hard for you to twist. If that happens, just push it in again, make sure it's in all the way, and you should see it's very easy to lock. There should be no resistance. You shouldn't have any plastic coming off it or anything like that, and it just locks nice and smoothly. That's really about the only two things that can go wrong. Obviously, the only other one is to make sure that this is screwed on tightly, attached to the piston, hand tight. As soon as it stops, don't try and force it, because if you push it too hard, you may sort of undo the thread, okay? And that's all.